So, good morning, good afternoon, good evening, wherever you may be. Thank you for joining us in the second of two webinars organized by the Clinical Engineering Division of the IFMBE on digital health innovations in the time of COVID. You will probably appreciate that this is one of the silver linings of the COVID pandemic, which still continues to ravage many regions, including my own, the African region. So yesterday's webinar was a great event. There were exciting, insightful presentations, painting a new reality in a new normal post-COVID context. And if you missed it, I urge you to view the webinar. The link to the webinar will be put in our chat. So it's my particular pleasure to welcome our faculty for today's event, which has got somewhat broader reach geographically than yesterday's event, and we've tried to be representative as possible. Each webinar follows the same structure, which is to begin with comments and presentation on national digital health policy. That is followed by clinical digital health innovations, then looking at entrepreneurship and intrapreneurship, then artificial intelligence, telehealth, and then finally a national digital health strategy. So that format, as I said, was followed yesterday, and we will largely align with that format today. Please remember, we've got chat, we've got question and answer, and feel free to post comments in the chat or raise questions in the Q&A. But now I'd like to hand over to my co-moderator, Pedro Galvan, for his introductory remarks.
Good morning, good afternoon, good evening, everybody. I'm glad to be here again after the yesterday's great presentations, as mentioned Mladen. I will like to introduce to all the faculties very short regarding the digital health perspective in Paraguay, and please the next slide. In this regard, I can tell you that the digital health play a very important role, is very strategic to integrate and support national health goals. In this sense, we mentioned yesterday that we have two big issues. One of them is the national policies on health data, as mentioned under others by the faculties, is to ensure that data protection and privacy are consistently. And the other thing is standardization. And these issues was mentioned by all the people yesterday, the participants and all the faculties. In this sense, I can mention that the WHO and PAHO have approved health standardization and interoperability. That is to take care about these two issues, and I will open the today presentation. The next, please. The aim of the today webinar is to show how clinical and biomedical engineers in low resource settings deploy digital health and how they can improve life cycle health technologies while improving also patient safety. Let's begin, and in order to take care about the time frame, and please each speaker have 10 minutes.
So thank you, Tom. In my opening as moderator, I'd like to position digital health innovations in the broader healthcare and health system context by referring to concepts and features from the WHO's World Health Report of 2000 that focused on health system performance. You can see coverage and effective coverage. So these concepts were important then, and just as important now, if not even more so, in the context of the COVID-19 pandemic response and the new normal. So the digital health interventions, such as those presented in these webinars, allow health systems to firstly leapfrog over constraints that previously may have limited their ability to provide cost-effective interventions to their populations, and secondly, to thereby facilitate greater access, utilization, and effectiveness of scalable, high-impact interventions. These concepts also talk to failings in the quality of care, next slide, that first surfaced as a global healthcare issue at the turn of the century. The Institute of Medicine's 6 criteria or domains for quality of care have been added to as shown here and have become generally accepted. Looking at these, one has to conclude that the topics presented in these webinars go far beyond improvement of health technology lifecycle and patient safety, as important as those may be. Of note also is the ethical dimension that is relevant to most domains, remembering that healthcare interventions are about people and for the broader communities they find themselves in. Lastly, in linking digital health interventions to the health system, it is useful to consider, next slide please, linkages to the WHO classification of digital health interventions published in 2018. These linkages will help to ground the digital health interventions in healthcare practice in all regions and countries. Next slide. Thank you. So we are really talking about health system challenges. And with that, I'd hand back to Pedro to introduce the first speaker. Thank you.